Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. Adena Health System offers patient services in 13 counties in South Central Ohio. Physician alignment strategies have supported the growth of the rural patient care network. Today, I'm joined by Dr. John Fortney, Chief Medical Officer, and Jeff Graham, Chief Strategy Officer, to discuss physician-integrated strategies in a rural regional patient care network. Welcome, John and Jeff.
Thank you.
Thanks for joining me today.
Thanks for having us.
Now, you've seen some big gains in patient satisfaction and quality. To what do you attribute that to?
Our Chief Quality Officer is also in charge of patient experience. So that what we've been able to do is to have doc-on-doc interaction. In the old days, as I call them, it was an administrator. He'd go in and talk to the doctors. Your patient experience scores aren't good, and what would happen? The doctors would say, well, we don't believe the data. It's perceptional. It's soft. You know, the only people sending back surveys are those that don't like us because we didn't give them what they wanted. And, you know, there were a litany of excuses. Once we sent the docs in and went over their Press-Ganey scores and looked at, you know, their top two problematic areas and asked them to focus on that, we've done extremely well. We've seen that curve go from flat to up precipitously by paying attention. And I think it's because of the doc-to-doc interaction. When your peers are coming in and telling you you're not doing a good job and that's unacceptable, it's far different than if Jeff goes in, an administrator, and tries to say that, you know, you're not pleasing your customers because the excuses start. When you send the doctors in, the excuses end. So that we realize now that this is truly a doc-on-doc situation and quality-wise.
Yeah, I believe it really comes down to the culture. And the engagement of the culture, and I think that's where our physician-led model, to John's point, has really been effective. In the consumer's mind, are you truly delivering on your product and what you say it is? When you look at quality outcomes, when you think back to just the core measures, and when we look at CHF patients, and Dr. Forty referred to one of our physician leaders, our Dr. Tucker, who's our Chief Quality Officer. The pilot that he did on 30 patients, I believe it was, John, 30 patients, he reduced the readmission rate on them to 0 just by using evidence-based protocols, which is also something that's very important in an integrated model because you have the ability to really establish an evidence-based protocol easier in an integrated system versus a non-integrated or a traditional health system as we know it today. So that being able to have those physicians working together and also focusing on evidence-based medicine together and working through those issues, we're starting to really see some great outcomes.
And I think most importantly, when you look at our vision is to be the best healthcare system in the nation, that can't be done without quality output, so that our physicians have bought into that. So that just because we're in a town of 20,000 doesn't mean we can't be the best healthcare providers in the nation. It just means that we have to try harder. And we're actively doing that through, you know, many different venues. And one, as Jeff mentioned, was Dr. Tucker's project around congestive heart failure and following those patients, 30 of them, from their hospitalization to home, adding resources, calling them, making sure they got their proper medications, they could afford them, a doctor's appointment in the near future, not 3 months away, but 3 days away, so that we wanted to see what the effect would be if we really were adamant about following that patient after discharge. At the center of this has got to be the patient. How do we give them the best, most effective, both clinically and cost-wise, care that we can?
And I would add as well, you know, as a lesson learned, one word is transparency. And as John mentioned, with the board, the medical staff and administration coming together, everybody being transparent And that was something that took some time to build that relationship, but transparency and trust. If you don't have that, you will never be able to achieve a integrated health system.
Thanks for joining us today.
Thanks for having us.
Thank you.
Appreciate it.
Appreciate it.